Okay, you can go ahead and... Oh, no.
Oh, oh my gosh.
Yeah, it's really sensitive.
I didn't even do anything. I'm afraid to touch this thing now. Is it because of this thing? Like this? Or like that, yeah. Because I think this thing. Oh my gosh. I didn't do anything.
No, it's not you, it's the cord. Here, let me use we might have to use the other one.
Which other one? Is there another cord?
Yeah, I have another one, but it's gonna have to plug in on that side.
Oh. I'm afraid it's gonna go in and out. Like, what am I gonna do?
Yeah, if you want, there's snacks on that side. We have some fruits and nuts, and we're gonna get started within the next 2 minutes or so. We have some technical difficulties, so I'm gonna go figure that out.
I'm afraid to move. Stand still.
We're good? Okay, so there.
So.
If not, then I'll have to switch to that side. I think we're good for now. Try clicking one side over. Yeah, okay. Alright.
Okay, go ahead. Okay. All right, we're going to get started. Everyone wants to take a seat, and if you want to grab a quick snack before we get started, go ahead. So my name is Dr. Suzanne Kim, and I'm one of the physicians here at the Center for New Medicine. And before we get started actually on our topic tonight, I just want to let you know you guys got some raffle tickets, and we are going to be raffling away 3 far infrared sauna treatments and also 2 coffee enema kits. Everybody's favorite. The reason why I picked the coffee enema kits, because those are patients who have Lyme know that's their best friend, one of their best friends. So anyway, so let's go ahead and get started. And how many people here know somebody with breast cancer? Okay, and it looks like almost everybody in this room. So why am I asking that question? I thought we were talking about Lyme disease tonight. Well, the CDC has said that the incidence of Lyme is greater than the incidence of breast cancer now. So how many people know somebody with Lyme? Oh, okay. Well, everybody here, there's a little skewed audience tonight, but that just goes to show you that I think about equal number of people who raised their hands for breast cancer, it was about equal for Lyme. So, and I don't know if it's because most people here have an interest in Lyme, but I think that in the general population, it is increasing, but I think there are many people who still are completely unaware of this disease, and that's why we're having this presentation this evening. Okay, so this is just our facility, and a lot of you are patients here, but for those of you watching online, this is our facility, and this is me. Okay, so let's get started with some statistics. Lyme disease is the #1 spreading vector-borne epidemic, both here in the United States as well as in Europe. The CDC figures from 2013 have reported Lyme disease infecting 300,000 people a year. This is 10 times more than Americans than previously reported. In 2015, the CDC figures reporting 320% increase in cases. Okay, let's see here. Okay, so this is just a breakdown of the stats. So that's 25,000 cases per month, 5,770 cases per week, 822 cases per day, 34 cases per hour. So we have a problem. Okay, and here is a little map here of the reported cases of Lyme. If you can see it very well. So all 50 states have reported Lyme, and more than 65 countries worldwide as well. The disease was first, and I'll go into this a little bit later, but the disease was first discovered in Lyme, Connecticut, and has been expanding, though, since then, all across the country. The hot spots, of course, most people know are northern, Midwest, and on the coast, but on the coast of California, which many people here in California are unaware of, that there is Lyme disease here in California. Okay, so what is Lyme disease? Lyme disease is an infectious disease caused by a spiral-shaped bacteria, which you can see in this dark-field microscopy. It's a spirochete, and it's called called Borrelia burgdorferi, and it's transmitted by the bite of a tick. And so you can see the tick here on the other picture, and going from let's see here, from your left to my right, we have a little larva, a little nymph, and then a male adult, and then finally a female adult all the way to the right. Okay, and you can see how small these are and how easy they can be missed. Okay, so like I said, Lyme is here in California as well, and on the West Coast. And the primary carrier is a western black-legged tick called Ixodes pacificus, and its principal host is the gray squirrel. In the East Coast, it's a different species of black-legged tick called Ixodes scapularis, and the principal carrier there is a white-footed mouse. So different carriers, East and West Coast. Most common in the spring and early summer. It's the little the nymphs that are the most dangerous, and then but fewer than 30% of patients with Lyme ever recall a tick bite. Okay, so here's California. In California, they found infected ticks in 42 of 58 counties. And the western black-legged tick has been found in all but 2 California counties, so 56 in total. And infected ticks, like I said, have been discovered in 42 counties.
I wonder what 2 counties it is that hasn't been affected.
Right, exactly. Well, here it is. Or maybe those are the 2 counties. Yeah, so it's everywhere, and it's really not going to go away anytime soon. Let's see. Okay, so just a little history behind Lyme disease. It was diagnosed in 1975 in Old Lyme, Connecticut, as I said before, where it was mistaken for juvenile rheumatoid arthritis at that time. And then it was until 1981 that it was identified by Willie Burgdorfer, and that's where the name name of the organism came from. There's 5 subspecies of Borrelia burgdorferi itself, but over 100 strains in the U.S. and over 200 worldwide. 15 new species of Borrelia have been identified from 1990 to 2010. That's approximately 1 new species per year. So this diversity in the species is contributing to its ability to evade the immune system and antibiotic therapy, and therefore leading to chronic disease, as we'll see. Okay, so Borrelia may be the most clever bug that you'll encounter. It contains 23 plasmids, compared to 0 to 3 plasmids of an average bacteria. And the bacteria that has the most, next one closest to it, has like 7 plasmids. So these plasmids have been studied and found to be genetically engineered, and some of you may know these so-called conspiracy theories, but this is good evidence that this was developed during World War II by the Germans and then later perfected, so as biological warfare. So these plasmids are extra DNA material containing information that grants its a whole host of advantages. So that's what allows it from being killed, allows it to change shape, as we'll discuss in a little bit, and also allows it to go dormant, go intracellular, make toxins that kill our antibodies. So it's a really very very versatile and very dangerous bug. So Lyme coinfections. So what happens is that when a patient gets a tick bite or becomes infected with Lyme, they don't just get Borrelia. It comes with all of its friends, and their names are Babesia, Bartonella, Ehrlichia, Rickettsia, which causes Rocky Mountain spotted fever, Anaplasma, Tularemia, Brucella, Protomyxoa, Mycoplasma, and Microfilariae. So there's all of these different organisms that can come at the same time, and they usually all come together. In fact, 45% of patients are co-infected with up to 5 different pathogens. Okay, so what are the acute symptoms of Lyme disease? So initially, after a patient is infected, they can experience flu-like symptoms with fevers, fatigue, swollen glands, sore throat, nausea, vomiting, headaches, stiff neck, and photophobia. They can also have like Bell's palsy or other neurological symptoms with half their face being paralyzed. And then the classic rash that everybody thinks of with Lyme's is called, actually there's a typo there, erythema migrans, which is like bullseye rash. I'll show you in just a minute. Usually occurring at the site of a tick bite about a week after it's occurred. But fewer than 50% of patients recall ever having any rash. So if you're lucky enough to have a rash, then maybe you'll get a diagnosis. So here's the classic erythema migrans bullseye rash that most people identify with Lyme disease. But it also can look like this, and as you can see here, there's not that bullseye rash, and it just looks red, and a lot of times it can be mistaken for a spider bite or some other type of insect bite. Okay, so if Lyme disease, like I said, if you're lucky enough, a lot of times to have the rash and get diagnosed, or you see the tick, and usually if you get treated for anywhere from 2 to 4 weeks of doxycycline, you have a good chance that you could eradicate the disease. But the short-term treatment courses have resulted in upwards of 40% relapse rate. So it's not a guarantee. Even if you get treated, you could have relapse and continuation, especially if the treatment is delayed. There's never been a study that demonstrated that 30 days of antibiotic treatment cures Lyme disease. However, there is much documentation demonstrating that short courses of antibiotic treatment fail to eradicate the Lyme spirochete. Okay, so if the Lyme is treated or and relapses, or if it's not treated, after several months, patients can go on to develop severe and chronic symptoms. Over 38 symptoms associated with chronic Lyme disease, and usually often associated with its co-infections. And Dr. Richard Horowitz, which some of you may be familiar with, he has come up with the term Lyme MSIDS, a multisystemic disorder with multisystemic symptoms, and established a 38-item screening questionnaire. And that's what you have in front of you, the handout I passed out. So feel free to fill this out, if you've already filled it out. And this questionnaire has been validated, and and we'll go over it at the end, but it has a good ability to identify if a patient has Lyme disease. So this is a nice, and this is available online for those of you joining us online at www.cangetbetter.com. Okay, so here's a nice little diagram of some of the different symptoms that can present with somebody with Lyme. And if you start at the top and the brain, you can see confusion, forgetfulness, disorientation, and then you've got headaches, sound sensitivity, light sensitivity, double or blurry vision, ear pain, mood swings, irritability, depression, anxiety, and panic attacks. We're going to go over these in more detail, but Bell's palsy, as I mentioned earlier, persistent swollen glands, going down to the chest pain or rib soreness, racing heart, and sudden blood pressure rise, going down to the gut, lots of gastrointestinal problems. Some people only present with those, including nausea, vomiting, and irritable bowel. There's joint pain and swelling or stiffness that can happen, muscle twitches, muscle pain or cramps, and then tingling or numbness of the extremities. And a patient can present with, a few of these, one of these, or usually, though, it's usually several of these symptoms. Okay, so Lyme disease, therefore, has been called the second great imitator. So who knows what the first great imitator is? Anybody? No? Okay. Well, the first great imitator is actually Treponema pallidum, which is also a spirochete that causes syphilis. So in the same family. And similarly, it also has similar course of acute and chronic phases of disease. So, very similar, bugs. So this is called the second great imitator because it can mimic every disease, as we kind of saw all the different symptoms. So what happens is a lot of times people come in and they've been diagnosed with chronic fatigue syndrome, fibromyalgia, with widespread pain, autoimmune conditions, including seronegative rheumatoid arthritis, multiple sclerosis. Neurologically, they have headaches or migraines, even brain tumors. Just a note on that, this past spring we went to a cancer conference, and one of the lecturers presented data showing that glioblastoma may be actually caused by Lyme disease, because she treated patients with glioblastoma. Well, she tested them, they were positive for Lyme. She treated them for Lyme and their brain tumor went away. So it's a very interesting correlation there. And then neuropathy, radiculopathy, encephalopathy, all these lopathies are just inflammation. Cranial nerve palsies, carpal tunnel syndrome, which is very common. I know a lot of people have come in just for carpal tunnel syndrome as well. Gastrointestinal and urinary symptoms that can present with IBS or IBD, which is inflammatory bowel disease, and interstitial cystitis. And then gynecologically, going to have pain syndromes, dyspareunia, pain with sex, or neuralgia, so like nerve pain.